Evening everyone, welcome back to the treatment room at 152. If you haven't seen my videos before, my name is Stacey and I'm a fibroblast technician. This is a anti-aging treatment. It's also used for removing skin tags, blemishes on the skin, as well as wrinkles and getting rid of the crepey skin. You know, sometimes it starts to get crepey on the eyes, it gives the sagging eyes, you can have it on your neck. We can tighten jaw lines, all sorts of things with fibroblast. And so tonight I just wanted to do a quick video on fibroblast versus surgery. So the first thing that you're not going to have with fibroblast is there's going to be no cutting of the skin. We reduce the skin. We are using a plasma arc. This shrinks the skin back, and basically by having no cutting on your skin, because with say an eye lift for example, the skin's stretched, excess skin taken away and stitched back up in the new place. With that you're going to get the possibility of scarring, and you're also just stretching the skin, the crepier skin, the stretched skin that's already there. It's just being stretched to be pulled back into position. With fibroblast, we're actually shrinking that skin, so we don't have to cut anything away because we're shrinking it back to its original place. And then the work underneath is what gives us the structure to give us the longevity of the treatment, 3 to 5 years. So because there's no stitches and there's no cutting, there's minimal downtime. As you've probably all seen from videos of mine and others, it's the dots. And that's what people, the main question I get is how long do the dots last? Depends on your healing and how fast you heal. Some people are 3 days, some people are a full 7, but anything between 3 and 7 days is when you're going to lose those dots. You're then going to be left with pink skin that has to have a factor 50 on it to stop any pigmentation. However, if you were to go down the surgery route, obviously your downtime is a much longer process, and you'd also probably feel a lot more uncomfortable going out after having surgery than you would with the fibroblast, because once the dots are all sort of clearing up, you can then put makeup on and cover it up, because there's no open wound. You're not going to be putting any makeup into an open wound like you would if there were stitches and waiting for the healing of the cutting to be done. So there's also no thinning of the skin. If anything, what you will find after fibroblast is when the initial phase has finished. I talk about phases in my other video. Once the initial phase is cleared, for the next 8 weeks, you're going to just see improvement week on week on week. And the texture of the skin is actually fuller, it's thicker, it's stronger, it's younger. There's no thinning of the skin. It's almost sort of rejuvenated is a word I would use, and you can literally feel it to touch. You can see the difference in the texture of the skin. And although it seems to be the biggest question is how much, well, much cheaper than surgery. So you've got much less downtime, the outlay is much less, and the recovery process is actually giving you longer results than if you were to say just stretch the old skin. Because like I said, with the fibroblast, it's not just doing that top layer of skin. We are working deep within the skin and rejuvenating those layers. So that's the plasma versus surgery. The other question is plasma versus fillers and Botox. I get asked this quite a bit. The two can work together if that's what you want. Most people who come to me for their eye lifts or their lips and things like that want to just naturally enhance their face. They don't want to completely change the way it looks. They would like the wrinkles gone from their lips. They want their eyes lifted so they're not sort of hanging down, and they can get back to putting their eyeshadow on how they like to have it. You know, some people feel their cheeks are sort of drooping, so we tighten it. We aren't ever doing anything that's extreme to the face. It's not anything that's going to really dramatically change the look of your face, other than reducing wrinkles, which obviously takes away the years. So for the Botox question, for me, is generally which is better. Lots of people feel that because Botox isn't lesser outlay? Well, initially plasma pen or fibroblast technology, whichever we call it, is a bigger outlay, but you're going to get 3 to 5 years from this treatment. Even if you had to have the full 3 treatments, you are still going to have less of an outlay overall than having fillers or Botox every few months, because obviously people hold on to fillers and Botox at different levels and have them topped up at different times. Some people are 3 months, some people are 6 months, some people can go a year before they feel like they need to top that up. So not only is it cheaper overall, but you're getting longer lasting results, because even if you came back every 8 weeks to get the full 3 treatments, most people are happy after 1. But say you had the full 3, you are then going to have 3 to 5 years of not having to worry about having to go back and getting that topped up. And also, we're not just filling in a crease, we're actually shrinking the skin back, we're actually lifting the wrinkle out. So whereas a filler fills, or Botox sort of stops the muscles from working, this is actually pulling those creases out, so they're just not there. So as it wears off with a filler, that crease obviously is coming back because it's still there. It's not gone anywhere. With a fibroblast, you are actually removing the crease. That's not to say that the two can't work together. They just can't be done with Botox or fillers being done and then the fibroblast. You can have the fibroblast to remove your resting lines, especially with frown lines. If you're going to frown, you're still going to get lines with it. However, your resting lines will be much less noticeable, to the point that some people, after even just 1 treatment, will have absolutely no lines left at all. But even if you don't have the lines left at all, some people prefer the look where there's no movement. Well, if you then have Botox or fillers, you're then going to then stop that crease from coming back, because you're not going to be able to pull that face. So they can work together. The fibroblast has to be done first. I can't do fibroblast on top of Botox or fillers. It has to be done the other way around. So that's your plasma pen stroke fibroblast technology versus surgery and Botox and fillers. If you've got any questions, please don't hesitate to contact me or to comment below. Thanks. Bye.